Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is the non-operative treatment of adult scoliosis. Adult scoliosis involves rotation and curvature of the spine due to degeneration. It is very different than pediatric scoliosis. It's often painful. Most pediatric scoliosis is not. It's stiff, therefore it's not responsive to bracing. Pediatric scoliosis, when a person is still growing, is responsive typically to bracing. And with adult scoliosis, typically you get both back and leg pain. I'll show you why in a moment. Why does it occur? Adult scoliosis occurs for two reasons. One is when a person has pediatric scoliosis and then they become skeletally mature. If the curve was over 40 degrees when that occurred, it usually gets worse at about 1 degree on average per year. It doesn't sound like a lot, but think about it. You're 20 years old, then you get to 70, that's 50 years. So add that on to a 40-degree curve from when you became skeletally mature, that's over 90 degrees. Now, the other reason it can occur is due to spinal degeneration, starting with the disc. Okay, so you may have no scoliosis as a kid, and then you can end up getting it as an adult. It starts with disc degeneration, and that pushes stresses to the back of the spine, which then causes the joints, the facet joints, to break down, and that typically occurs asymmetrically, and then you can start to get degeneration and curvature, and then nerves can start to get pinched. So what you see here in this drawing is degenerative scoliosis, and this is a normal disc space up here, but you can see that this disc is gone, and this disc is gone. So that's how you get the curvature. And these nerve roots that are trying to get out on the concave side, they get pinched. They just don't have as much room. So that's why you get back pain from the arthritic pain and leg pain due to these nerves being pinched. All right. You can get muscle weakness as well and aching from having a tough time standing up straight. And then when these nerve roots get pinched, you can get buttock and leg pain because that's called spinal stenosis. Well, what are the treatments that are available? Over-the-counter medications can help from mild to moderate pain. This can include Tylenol, anti-inflammatories like Advil and naproxen. Prescription medications can include higher strength NSAIDs, so if you need a higher dose. Neuropathic medications such as Neurontin or Lyrica can help a lot with the spinal stenosis pain. Narcotics for when pain is really bad. Topical pain creams can help. Physical therapy for strengthening and stretching, and modalities like ultrasound and electrical stimulation, and then interventional treatments. The interventional treatments, there are a few. So what you see here is an injection right into the facet joint that may be arthritic and painful, right? So that can help a lot with the back pain. And the steroid can stick around and provide pain relief for weeks to months. Trigger point injections can help if the patient's having aches and spasms in the back. Once you go from there, medial branch block is an injection that does not go right into these facet joints, but it goes into the area around it, and it can stop the transmission of pain signals through these medial branch nerve endings. That's how the joint gets sensation. If you stop that sensation, you can cut back on the pain. Now, if the facet joint or the medial branch block wears off, you can either repeat it or move on to this, which is a radio frequency ablation. The needle goes to the same place, right around the joint, and it just heats up this area and deadens these nerve endings. All right, that can provide pain relief anywhere from 6 to 18 months, and it can be repeated and work typically just as well. Epidural injections are the steroid medication going around the nerve roots that are getting pinched, and that can help a lot with the buttock and the leg pain from the spinal stenosis. What are the outcomes? It's a very big decision to have surgery for adult scoliosis. There's a very high complication rate, very long rehabilitation rate. Over 90% of those with adult scoliosis can achieve satisfactory level of baseline pain without surgery. Most patients don't end up needing the surgery. It's elective, it's quality of life, it should be a last resort. There's over a 50% complication rate with the nerve decompression and fusion procedures, and adults just don't tolerate these surgeries like they would, if they were younger. Colorado Pain offers the top pain management in the Metro Denver area, along with locations also in Buena Vista and South Granby. Over 50 insurance plans are accepted. The board-certified pain doctors offer both medication management and the interventional procedures mentioned here. They've won the Patient's Choice Award 5 years in a row. The number to call for scheduling is 720-306 9575 and visit us on the web at painmanagementdenverco.com. I'm Dr. David Green with the Colorado Pain Network. Your pain stops here.